Yeah, so the UpFrontPSMA trial is a first-in-field study of lutetium PSMA radionuclide therapy in men with newly diagnosed metastatic hormone-sensitive prostate cancer. So at the GU ASCO meeting, my colleague at Peter Mac, Professor Michael Hoffman, presented data from the TheraP clinical trial, which was looking at lutetium PSMA in men with metastatic castration-resistant prostate cancer, and showed that it was superior to Cabazitaxel chemotherapy, which is really a groundbreaking result. And the whole point of the UpFrontPSMA trial is taking that data from the more advanced setting and bringing lutetium PSMA forward into the treatment paradigm for prostate cancer. We've seen with docetaxel chemotherapy and with androgen receptor pathway inhibitors that bringing them forward and using them earlier in the disease course has been very beneficial, and we're hoping the same thing will happen with lutetium PSMA. So this is an open-label, randomised Phase II multi-centre study being conducted at 12 centres in Australia. It's open at 5 centres currently. We'll recruit 140 men. We've recruited just under 20% of the total cohort at the moment, which we're pleased, given some of the restrictions we've all had with COVID in the past 12 months. And the men are randomised to either androgen deprivation therapy plus 6 cycles of docetaxel, which is the control arm, or androgen deprivation therapy plus 6 cycles of docetaxel plus 2 cycles of lutetium PSMA. And the lutetium PSMA is given before the docetaxel starts. So to be eligible, men have to be within 12 weeks of diagnosis of prostate cancer. They have to have high volume disease on their PSMA PET scan and also highly PSMA avid disease. The primary endpoint will be undetectable PSA, which is a PSA less than or equal to 0.2 nanograms per mil at 12 months, which we know is a surrogate for outcomes in metastatic hormone-sensitive prostate cancer. And we'll also have other key secondary endpoints such as PSA progression-free survival, radiographic progression-free survival, safety, overall survival and quality of life. And we're also collecting plasma and blood samples for subsequent correlative and translational studies. So we hope that the trial will finish recruitment over the next 12 months and then read out thereafter, and that it will be it will demonstrate the superiority of adding in lutetium PSMA up front for men with de novo high volume metastatic hormone sensitive prostate cancer.